The broadcast is now starting. All attendees are in listen-only mode.
Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Training and Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch will cover strategies to educate patients on electronic access of their health information. We are joined today by Matt Hager of the National eHealth Collaborative. Matt is an expert on patient engagement, and he's going to describe for us both the patient engagement landscape and the tools NeHC has helped to develop to facilitate patient engagement success. It's our pleasure to share his expertise with you today. Please note that you can ask questions of our presenter at any time during today's session by entering them into the chat area during the presentation. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, please note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of the event. So people often ask during the session if they can get the slides and a video version of this, and rest assured that we'll send those out to you. All right, Matt, well, thank you for joining us today.
Absolutely. Thank you very much for having me.
Well, let's get down to it then. First of all, most people probably know something about patient engagement, but maybe you can start by giving us a definition.
Sure, absolutely. One of the main problems that people have had when it comes to patient engagement is really how do you define it? And as we've seen, the National eHealth Collaborative, or NeHC, has done stakeholder surveys over the past at least 3-4 years, and what we've found is that not everyone can agree on what a single definition of patient engagement really is, and it also means something different to people who are in different parts of the industry. For example, health plans, hospital systems, physician practices, patients themselves really have varying definitions of what it means to be engaged and what it means to have patient engagement. And really at the core is the fact that patients can take control of their own care. And again, that is very, very broad. So organizations who are working to improve patient engagement and even patients themselves are really having a hard time figuring out where to begin. And even if they've already begun, how do they move forward? And so that's something that we as an organization have really tried to address and try to come to terms with in a way that will help everyone improve patient engagement and get better outcomes as well.
Well, you mentioned your organization. Tell us a little bit about who NeHC is and how does your work involve patient engagement?
Absolutely. NeHC is a public-private partnership focused on encouraging widespread effective adoption of health IT in order to create a more patient and family-centered system that drives better healthcare outcomes and better value. And we play a unique role to convene stakeholders to tackle really challenging issues, and patient engagement is one of those very challenging issues, and also develop practical tools and solutions to help the entire healthcare community implement health IT successfully. And we really have three main areas of focus and programs. Health IT education is one. I manage NeHC University, which takes information from all the different projects that we have, and we work with stakeholders to provide education in that respect, get feedback from our stakeholders, and just really continue the dialogue through the industry. We work in health information exchange with our Health Information Exchange Learning Network as well. But one of our third main program is consumer engagement in eHealth, and it is through that that we developed and created the Consumer Consortium on eHealth, which is designed to serve as a collaborative forum that had over 150 organizations sharing best practices, tools, resources, experience, ideas, and all of that related to effective consumer engagement in eHealth. And through that work, it was about a year, and it's still going on, but through about a year and a half of work, and under the with the help of Leslie Kelly Hall of HealthWise, we created the patient engagement framework, and that's really to design. It's really designed to guide healthcare organizations in developing and strengthening their patient engagement strategies through the use of eHealth tools and resources. The framework is free to download on our website at nationalehealth.org. You can see how we've worked through different levels of patient engagement, from very basic, very simplistic levels to very sophisticated, very high levels of patient engagement. And then again, through that work, with a partnership with an organization called Health Cause, we developed an assessment tool called the Consumer eHealth Readiness Tool, designed to be an interactive again, resource that an organization can take to gauge their level of patient engagement. And that's so that they can see where their gaps are, where they're doing well, and then see how they can, where the next steps might be, and what else might be available out there for an organization to kind of move forward.
So you talked about the framework a little bit, but tell us more about what are the benefits of people having a single sort of shared framework for their work on patient engagement.
Sure, and as people who have worked on patient engagement know, for a long time, organizations kind of work in all different directions, and patient engagement is an issue that really benefits the industry as a whole, and it's one of those issues that really touches every aspect. I mean, again, from the patients themselves to health plans, payers, HIEs, and all of that, and organizations through the framework can still, work on their specific initiatives, move forward with what their organization's goals are, but also to have a framework to look forward in patient engagement as an industry as well. I mean, here are the things that a patient might expect from an organization just basically starting off in patient engagement, and that might just be do you have a printable form that explains what advanced directives are? And do you have, are you able to schedule appointments online? It's some things that are very, very basic, very elemental to an organization that's just getting started, but then as you move through the framework, it gets far more sophisticated, even to an aspirational phase, what we call support my e-community, and that the final phase is probably a level that no organizations have really achieved yet, but it needs to be a goal. And if we have the single framework, kind of for patient engagement that organizations can all kind of come together and use, we'll be able to help each other move forward in some of the issues that are really tying, organizations up, setting them back, and help create a dialogue and a collaborative area for them to take the next steps.
So how does the framework then help organizations with patient engagement without sort of hemming them in and limiting what they can do with patient engagement?
And that was our main goal with what both the framework and the Consumer eHealth Readiness Tool are, and that's to make sure that the framework and the CeRT tool especially identifies gaps and highlights resources that are available, but we don't tell an organization what they need to do next. It's something that an organization should know what's out there, what they want to do, but we really don't want to box them into a specific prescription, if you will. We want to help them move forward, but let them kind of be creative. There are other solutions that can be developed to help in this, and it's very interesting to see what people will be able to come up with. But at the very basic and core level, a lot of what's in the CeRT and the framework are specifically aligned to meaningful use objectives and recommendations. And as you move from the very basic level of the levels are inform me, engage me, empower me, partner with me, and support my e-community. The first two levels, inform me and engage me, are both aligned with very basic levels of meaningful use stage 1. But as you move forward, empower and partner with me, and even into the final aspirational phase of Support My E-Community, we're getting into Stage 2, Stage 3 objectives, recommendations. And so it allows an organization to see where they meet these criteria. It gives them a concrete example of what is available, what is, what meaningful use recommendations are, but then takes it a step further to help them out, moving forward as well.
So on the meaningful use front, why is it important that the CeRT and the framework be aligned with MU objectives?
Well, obviously, meaningful use is top of mind for a lot of organizations, especially since the patient engagement in recommendations and objectives were included. So it's something that organizations are really going to be focused on. And within the framework and the CeRT, we do identify exactly where the which questions, which parts of the assessment, and which parts of the framework are directly linked to meaningful use. And the CeRT itself, there are about approximately 102 questions, I believe. When it's all said and done, it takes about an hour to complete, start to finish. At the end of it, you receive both a summary, kind of an overall report of where your organization is in the varying levels of patient engagement. Once again, the levels of the framework, in addition to levels that we've then added information on where your organization sits with technical requirements. What do you have in place on the technical side? What do you have in place on the organizational infrastructure side, and how well you're able to evaluate and measure results. And it will show you a bar graph that essentially says, here's how well you're doing in each area. Here's how well you're doing overall. But then at the end, you can also download a complete report summary, and that will show an organization, whoever an organization would like to show, where your specific organization is in relation to the meaningful use criteria. Where can your organization take smoking status under consideration? Can you take that information on that? Is there, do you have a PHR implemented? Any information like that is all captured, and then as an organization moves through the framework and the CeRT, and then specifically the CeRT, that can be taken as many times as they would like over the course of a year, which is as long as our subscription is, to show, here's where we were at the beginning of the year, here's where we were in 6 months, and here's where we are, at the end of the year, to show the progress. Here's the meaningful use criteria we are now meeting, and that really gives an organization a basis for either where to start and where to move forward as well.
Before we continue, I just want to remind our audience that we will be sending you the slides after the webinar, and you can ask questions of our presenter at any time by typing them into the chat area. We'll get to those questions just as soon as the presentation is complete. So let's continue, Matt. What are the biggest roadblocks that you found, that NEHC has found, to successful patient engagement?
Well, one of those was what we spoke about on the first question, was the definition, and that's sometimes it's so daunting that organizations don't know where to begin, and then at some points organizations try to do too much too fast. And one of the goals of the framework and the CeRT itself was to show that every step in the direction of patient engagement is a step in the right direction. And we want to make sure that organizations know that you don't have to kind of jump in right away if you're just starting off and get information on self-care or home health device data. Just a practice doesn't have to install that right away. The beginnings of patient engagement are putting an emphasis on simple tools that can make healthcare more convenient and accessible for patients, and that includes providing patients with standard forms, on the printable and electronic side, and just providing information on advanced directives, HIPAA privacy and specific conditions. And then as you move forward in that, as you work to the next level, you can start to get a little bit more mature. You start to schedule patients online. You start to allow medication refills online, and then you start to integrate basic patient-generated data into EHR systems, patient experience ratings, and then before you know it, you're connected to public health reporting systems, and coordination of care then happens seamlessly across primary, specialty, and acute care providers. It's little steps in the direction of patient engagement that we wanted to make sure people understood that are great steps in the right direction. And I think that that kind of alleviates one of the roadblocks to to patient engagement itself, where organizations think that they have to do too much too soon. And secondly, I think there is a lot of very, very brilliant organizations out there that are doing fantastic work with patient engagement, whether it's mobile apps, patient portals, anything like that. And that information is out there for a lot of organizations do partnerships and work on that end. And it's something that you don't want an organization to necessarily reinvent the wheel if they don't have to. And there's a lot of resources that are available for an organization to move forward with patient engagement. And I think that one of the parts that is included with the CERT is a solutions directory and a resource center. And what we want to do is, without giving a specific recommendation one way or the other, an organization can see that these options are available, and that other organizations have overcome a specific challenge in the past, and whether or not it's undertaken, at least it's available. And that again alleviates one of those roadblocks to successful patient engagement, is to work together on issues that might be a little bit challenging.
So if people are interested in these tools, what are the prices involved for using the framework and a CERT?
Sure. The patient engagement framework is free. It is available for a download on our website, which again is nationalehealth.org. The CERT does have a fee, and it does depend on the size of the organization that would be purchasing it. It's a subscription-based fee. You get a full year access to the assessment. As many people in your organization can take the assessment as you would like. The progress, a single assessment can be saved and come back to if, say, a person in your organization doesn't know all the answers, which we rarely all do. But it can be, progress can be saved and then started up again by someone else in the organization, and the report summary can be downloaded at any time. So we do have the pricing structure on our website again, and I'd be happy to go through it with any organizations that would be interested.
So give us an example of an organization or a group that's adopted CERT so far, and what the sort of success they've had has looked like.
Sure. We have begun work with the state of Kentucky as an initial adopter for the CERT tool itself, and the state purchased 13 licenses for the CERT and held an application process for the practices and hospitals and health systems in their state to determine who would receive the license to access the CERT tool itself. And they had a fantastic, incredible response, and more applications than they had licenses, and they're currently working to expand that offering to see if there can be additional licenses given. And they're going to use that information, the aggregate information that they receive from these organizations, to really help their knowledge and their work specifically around meaningful use, kind of where the organizations are, where the state is, where more help can be given. So it's an opportunity, as meaningful use kind of progresses, for states on the state level to see where they stand. And next, we have had organizations, again, that purchase a single license to see, as they're working through patient engagement and through that information, to see where they stand as well. And there's, we're open to a lot of opportunities. We just, we're open for ideas and all of that, and we want to just make sure that this is as much help to organizations as they progress on a very thorny and very, very important issue.
So besides purchasing the CeRT, how else can organizations be engaged with this process?
Well, at the basic level, they can, you are definitely welcome to download the framework and see it for yourself. We do offer a partnership and reselling options, which is a kind of what we're working with a couple different organizations on as well. And then we are also working with organizations to be a part of the Solutions Directory and Resource Center to provide as much information as we can to organizations as what's already available. And on additional levels, we do offer demos of the tool. If there's any questions, we're definitely available to answer those on a one-on-one basis. We do have a video that kind of highlights what the tool and the framework are up on our website. So if anyone would also like to get in contact with me, I'd be happy to answer any questions. And then since I do the education programs as well, we do have free education programs centering around consumer engagement. We definitely invite anyone to come and attend if you'd like to. So there are definitely a lot of options to help participate and help be involved.
So tell us more about this top performers list that's related to patient engagement.
Well, it's a question that we get by organizations. Is the assessment itself really gives a great overview of what the of where an organization is. So we have run into people asking, well, kind of why maybe we should do like kind of a Wired has a most wired companies list or something kind of to that effect, and it's definitely something that is a work in progress for us. I mean, I think that patient engagement is something that is really important to showcase, especially if an organization is really taking the time and the steps to do it well, to make their patients more engaged. And I mean, there is since it is a self-assessment, our top priority for organizations is to make sure that they know exactly where they are with their level of patient engagement. That's exactly where their gaps are, where they need help, where maybe they're spending too many resources, and so we do have it is something we would really like to do, work with some of these organizations who are in the top of their field in this, but again, without kind of compromising the honest assessment that they give themselves, because that's the way that we improve the industry, and that's the way that we improve patient engagement and improve outcomes as a whole.
All right, well, we went through those slides rather quickly, so we have plenty of time for questions from our audience. So I'd like to encourage all of our attendees to ask questions. You can, it's a rare opportunity to sort of ask any question you might have about patient engagement and get some expert insights into it. So please go ahead and ask those. But our first question is kind of particular to the HIPAA concerns around meaningful use. So I'll just ask the audience question, and then I might have a follow-up for you, Matt.
Sure.
So the question is aligning the CeRT with meaningful use. Does this cover the required information around the security risk analysis that Stage 1 requires for HIPAA?
That's a good question. We have, we are aligned with, Stage 1 of meaningful use, but don't get really into the specifics about what's in HIPAA. we really mainly focus as it relates to stage 1 is information on just whether or not tools are available, accessible, and whether or not an organization, say, uses fitness trackers or other health tools and administrative tasks. As we kind of get into kind of the specifics about HIPAA and very involved into privacy and security, we kind of let the organizations themselves deal with that. It's mainly whether or not your organization is on the path to, whether or not these tools are there and usable, and then kind of showcasing that, yes, this is a part of meaningful use stage 1 or stage 2 or stage 3, but beyond that, kind of getting into the nitty-gritty of it, we leave that more to the organization's discretion to make sure that they meet specific criteria.
Well, I was just going to add that, we get a lot of questions about the HIPAA risk, the security risk analysis that's required for stage 1, because I think it's, something that a lot of practices are trying to catch up on if they haven't already had a risk analysis. So it sounds like it's safe to say that this program will not perform the risk analysis for you if you're, if you're looking for that.
That is correct. We do not do that.
The follow-up I was going to ask, though, is, and you addressed this to some extent, but I'd just like to ask and see what you have to say about HIPAA and patient engagement in general. I mean, when people are talking about all of these, sort of the proliferation of mobile technology and to the extent that that relates to patient engagement, have you heard, or does the framework address any issues around HIPAA security for those devices, or is that more on the technical side?
That's more on the technical side. This is a very, on our end, it's a very high level assessment, and there are definitely concerns as we as organizations move through about a lot of, especially surrounding privacy and security. It's always a top issue, and one of the ways that we've kind of we want to make sure that we address what we can, but getting into some of those issues gets very, very deep. So we don't really touch on specifics about HIPAA. It's really kind of mainly an overall assessment, and we kind of leave those, again, specifics to the organizations as they kind of move through.
Well, because in many cases, I mean, from that technological standpoint, there's going to be different, proprietary technologies involved and that sort of thing, I'm sure.
Yeah,
so.
Exactly. And there are, I mean, obviously mobile technologies are incredibly useful and incredibly important to patient engagement, and that's something that, as an organization moves through the framework and through the CERT, and they get to the more sophisticated levels of patient engagement that they really have to take a look at. But kind of beyond that, we wanted to leave it at a high level so that that's something that organizations can kind of figure out on their own, and and maybe as not helpful as that answer is, that was more or less our thought on it, just because there's so many variables to it, and so much organization-specific type of information that it's sometimes best to leave that on its own.
All right, let's move on to another question. What about the many HIE and patient portals that consumers are being asked to sign into? How will the consumers handle all the necessary logins to get their patient records? So I don't know if that's a fair question to ask you, but have you in your experience with patient engagement learned about maybe single sign-on technologies, or how can you address that?
I know that it's something, I know that organizations are trying to reconcile all of what's out there, and it's kind of not just in patient portals and patient and kind of those types of logins, but I think it's definitely an issue, and I think that it's another area that the industry is definitely working on, and it does make it more difficult for patients at a time when we're trying to integrate this great technology for the patients themselves, it kind of makes it sometimes more of a burden to try to have to reconcile, the flood of technology that's out there. But again, on our end, it's, we've definitely seen that. We don't quite know how it is resolved, how it can be resolved. But it's something that I think increasing, the dialogue between those that, your physicians and whoever a patient is working with will definitely help, because I do know that, that they're addressing it. I'm not entirely sure as to what the status of it is, but it is something I can take a look at and get back and maybe answer in a little bit more detail after doing a little bit more research into it.
Sure. I want to remind all of our attendees that we are going to send out written follow-ups to these questions. So if there's anything that, our presenter would like to address in more detail, he can get back to you with some of those answers. I think this issue of, multiple logins and multiple passwords is a kind of growing problem, even outside of not only just patient engagement, but even outside of health IT, because there's, on the one hand, you have growing security concerns. So there's, kind of more demand for having, non-intuitive passwords and frequently changing passwords and not using the same password for every site and that sort of thing. But then on the other hand, you've got more and more logins to more and more technologies. It reaches the point where if you can't remember your passwords, then it defeats the whole purpose of everything. So I think this is a big problem that everybody's trying to grapple with.
Exactly, whether it's banking or healthcare or even a variety of even on our website, we have a opportunity to log in and register, and for some people it's, well, I've got 12 different things that I have to remember. So I'm going to write down the passwords, but that's not secure because, somebody grabs onto your notebook with all of your passwords into it, that's that. And I agree. It's an issue that goes beyond healthcare, and it goes, but healthcare, is obviously very important. People don't want someone just kind of snooping into that, but, it's something that definitely is a difficult one to crack if patients want to be, if patients are going to want to be engaged, they want to know that, it's not going to be more of a burden. It's supposed to make their life easier.
Right. You don't want to make engagement such a hassle that no one wants to be engaged.
Yeah, restricts engagement.
But we hear a lot about of this around HIPAA here at Format Approved because, it's the same problem of you got to find that sweet spot of security, but then at the same time, we hear stories all the time about people having their, log in to the EHR records on a Post-it note taped to their monitor, and of course that's a HIPAA violation. So
yep, and that's again, that can kind of go back to one of the roadblocks that we kind of discussed a little bit earlier, which beyond just a couple of the ones that I mentioned, but how do you balance that with engagement as a whole? You're trying to engage an organization, or as an organization, you're trying to engage the patients, but you have to walk that fine line between, being a burden, and trying to make the patient portal logins or what have you, more of a burden for them to log into than it would be to essentially ignore it, which is what you don't want. So with HIPAA and everything, I know it's definitely a concern for organizations, and it's something that I don't think we have really found that sweet spot quite yet.
All right, let's move on to another question. Do you provide hands-on assistance with identified gaps, or just the assessment and then the practice works on the identified gaps on their own? Or in other words, any specific guidance, or is it more an overall assessment?
Sure. One of the things I did neglect to mention is once an organization has finished the assessment itself, we do provide specialized links for that organization to learn, more about how they can advance through different stages through, the patient engagement framework and through the CeRT, and that's kind of where our resource center comes in. And what we've done is work to populate it with publicly available information from from organizations and from government entities, CMS. We've got information on Blue Button, for example, as well. We've got links to ONC's healthit.gov information, and so we do try to say, look, here's where you're at, and here's some more helpful information that might spur you along a little bit. And again, it kind of comes back to us not wanting to be too prescriptive with an organization, but we want to kind of help out as much as we can. And then again, an organization who would subscribe to the CeRT would also get access to the solutions directory, which we would hope would help them also see if there is any additional information that is available out there that would help them through. So it's it's a little bit of helping, but again, we don't want to tell an organization this is exactly what your next step should be. It's something that an organization should work through, but we want to help. I mean, we want to show what is out there, and we want to show what specifically might help move the ball forward a little bit.
So as a general framework and sort of that high-level assessment you were talking about, but there is also these resources available that really get into some of the nitty-gritty of what's possible or possible solutions that people might want to pursue. Exactly,
and additionally, it would be an organization could work, with ONC. ONC's got a lot of great resources available. CMS does as well. I mean, so there's, it might be something that, as an organization, you may not know about, and that might again help. And then when you take the assessment again, perhaps you're a little bit farther along, and you're able to show progress.
Well, that's one of the things that I think is great about this is there's so much interest in patient engagement, but I think there's a lot of uncertainty about how to proceed with it, and so having this sort of aggregation of information has got to really be useful for people.
Definitely, and it is such a huge undertaking for organizations, but the one thing to keep in mind is that any advancement is positive. I mean, if you're moving forward, even in very baby steps, you're in the right direction, and that's in something that I think maybe organizations don't quite it's we have to kind of meet this next step and this next step and this next step, but kind of taking a look at it, stepping back and saying, what, we've made a lot of progress, rather than kind of seeing what if you're just starting and you've got a long way to go, that's definitely daunting, but take a look at also where you have been and what you have accomplished, and that means a lot to a patient. Whether or not they know it right off the bat is a different thing. But I mean, to be able to refill a prescription online or to call and schedule, to do an appointment scheduling online, I mean, that's a lot for that's a big benefit for patients. And I think that it's helpful to take a look back at what an organization is able to accomplish.
So here's a question that's particular to the website. Could you give a little guidance on where they can go on the website to download the framework?
Sure, absolutely. If you, I can actually give you the very specific URL, and that would, if someone on there would like to access the framework right away, it's www.nationalehealth.org/patient-engagement-framework. And then that gets you right into you can take a look at it. There's a file that shows what the framework looks like. You do have to just input information, and then you'll be able to download it. But if on that web page, you can kind of see that it's kind of almost like a stepping stone, or from very basic on the Inform Me level to very sophisticated on the Support My eCommunity level.
And so that address was nationalehealth.org/ was it patient-engagement-framework?
Correct. Yep.
All right, and where can people go to get this CERT? Or I assume that's a more involved process since there's a fee associated.
You can get information on the CERT by going to, once again, on our website, nationalehealth.org, and then it's just /CERT, C-E-R-T. And you'll be able to take a look at a live, you can request a live demo, take a look at one of our a little brief 3-minute video or 4-minute video that we have kind of going over everything. You can take a look at the pricing structure on the left-hand side menu bar, and then there is also information on that page with how to, some more information. And again, if anyone would like to contact me, I'd be happy to speak with it at greater length. The demo really helps take a look at it. I kind of realize it's a little bit harder to just explain. But we would definitely be glad to do a live demo, answer any questions that you have. Feel free to email me or give me a call at any time.
Well, Matt, you've talked about how it's important for organizations not to focus too much on sort of their ultimate goals for patient engagement, but to recognize that marginal or incremental improvements are definitely valuable, and that you should take baby steps as you progress towards your goals. That said, I hope that you can tell us a little bit about, because you talked about that most advanced level of the framework, which I believe is supporting my eHealth community, or is that
community? Yep.
Okay,
so that's correct.
So what is sort of the ultimate goal here? What does it look like to have sort of a fully baked patient engagement strategy? I know you said that no organization has fully implemented this, but just describe it for us.
Oh, sure, and definitely organizations are on the right track, and again, we've kind of organized the framework in the sense of that an organization can be have parts of phase 3 done, for example, but maybe be a little bit behind in other areas that so you're kind of in a couple different I don't want to say buckets, but that's kind of that might be the best one that I can think of. But at the top, phase 5, support my e-community level, really what's featured are fully interoperable EHRs, record sharing among providers and non-provider members of a patient's care team, while granting the patient themselves access to privacy controls. And then at this phase, patients and caregivers are provided with things like online community support from providers, opportunities for e-visits, cost comparisons and outcomes reporting to really help a patient make more informed decisions about their care and treatment. And then providers at this phase, if you're meeting this phase, you'll likely be found participating in an accountable care or patient-centered medical home model, which again, like I said, very high level, but that's something to really strive for. I mean, fully interoperable EHRs is, obviously incredibly difficult, and allowing care cost comparisons and outcomes reporting is something to strive for, but we want organizations to always be looking ahead. And again, baby steps are fantastic, but like you said, you can't lose sight of kind of the top level. Where do we want to be in 2 years, 5 years, 10 years? And it's things that are difficult, things that will require a lot of work, a lot of collaboration within the industry especially, but it's something that is ultimately good for patients and for providers and organizations that are interested in this, and now with meaningful use in a lot of ways have to meet those requirements.
Well, you touched on a point that relates to one of our other questions, and then and there's actually another one in there as well, but the question from the audience is, how does this framework relate to interoperability? And I think the question is like, because interoperability is obviously a big part of patient engagement, how do the tools you offer help support that kind of central concern of interoperability?
Yeah, I mean, it's something that we're by kind of driving and the organizations towards the final phase of this, which is the one of the big tenets of that is an interoperable EHR. We would like to try to show that this is kind of, in order for exchange to happen, in order for this to be as seamless as possible, interoperability needs to be addressed and reconciled at some point. And so, I mean, we don't kind of prescribe how to do that, which is obviously again a difficult, interoperability in and of itself is an incredibly difficult topic, and we could spend a lot of time also talking about that. But we like to say that this is kind of the ultimate goal, and this is what organizations, I mean, that's one of those items that an organization should always be kind of looking forward to, and that's we do highlight it in the assessment, we do highlight it in the framework, and it's something that again we don't give a prescription for, but we do make sure that it, as much as we can, it becomes top of mind.
Yeah, well, I think if you had a solution for the interoperability problem, you'd probably be locked up in a room by the ONC somewhere, and they'd be.
Oh, yeah, I'd be set for as
Right.
much as I'd be writing papers and all that stuff. So
That's right.
Yeah, that's again an incredibly, as everyone knows, incredibly difficult topic.
So you mentioned before about how at the top levels there's sort of this intersection between patient engagement and ACOs or value-based medicine. How do those two relate to each other? Why does patient engagement support a move toward value-based or pay-for-performance medicine?
Well, I think that, I mean, this is probably one that I would have to think about a little bit more, but I think that it's the ability for a patient to kind of make as an informed decision as possible about their own care, which is hard because again there are some patients, obviously we know, I mean, who are incredibly educated on their own care, who want to be, who want to have their lab results, who want to see their x-rays, who want to, be able to kind of compare their medical practices and their physicians and their hospitals the same way, maybe that they would compare a lot of other consumer items, which is, kind of where we kind of get a few of the terms between patient and consumer engagement. I mean, they really want to be consumers in healthcare, and that's, fantastic. I think, they want to be engaged, they want to work with and be a full partner in their own care, and then there are, some that want to just, in the end of the day, just be healthy. And, it's all in how, again, engaged the specific patient wants to be, which is again something that's difficult with patient engagement, is to try to walk that line between those who really want to be engaged and those who just kind of are happy just as they are, being healthy. But I think that as we kind of go into the final phases and into the very sophisticated aspirational levels, I think a critical part of that would be for patients to at least have the option of being able to compare cost, to compare performance, for those who might want it. And again, that's another huge issue that a lot of organizations have to kind of reconcile. It's and a lot of different parts of the industry have differing opinions. But I think at the very end, from a patient's perspective, that's a huge point. Or there are people that would love to be able to do that, and I think it's important for them to at least be able to have that option. But again, that's a very, very high level, very, very sophisticated part that I don't know if, again, people have really solved yet.
Well, you touched on an issue then as part of that. That's our last question that we have from the audience, which is how does patient engagement support a practice's revenues? So, as things move toward a value-based system or a pay-for-performance system, it's going to be an important part of meeting those goals. But that for most practices, that's kind of a bit off in the future. Maybe you can give us some insights into how patient engagement can help with revenue issues today.
Sure, and I mean, taking a look at where a lot of different industries are going, and that could be whether you take a look at online banking, say it's even choosing your mobile care provider or mobile provider as far as for a cell phone or for cable or something like that. I mean, one of the things that are becoming more and more important to consumers in some of those industries are how well they're able to do small things, and that's like, can you pay your bill online? Can you can you do any of those things online versus, say, sending a check or paying in person or something, scheduling an appointment or something like that. And again, this kind of gets back, and I know I've said this a couple times, it might sound a little bit old, but I think that as an organization and as a practice moves forward, even with the small basic steps, to kind of be known as that organization who's starting to really be on the cutting edge of what's available, and can you do medication refills online, how you're making life easier for patients. And again, it's a big undertaking, but it's a lot of a physician's ability to kind of be up with what how they treat their patients, again, like a true partner in their own care. And if it's a small step, that's fine, but I think that making life easier for patients will really make them want to come back, to continue to be with a practice or a hospital. And then of course there's meaningful use incentives and objectives, and which are items that are also very important. And
of course,
but I think that and this is kind of my own thought on that, but like I do think that showing that a practice is really up with trying to kind of be where other industries and other organizations are, really means a lot to patients, whether or not they use them on a regular basis. It'll take time. It definitely will, because it's a huge change. It's a huge change for patients. It's a huge change for practices. It's a huge change for health plans. But in the very end, it's a very important change. And I think that it'll really, at the end of the day, improve outcomes and improve experiences for patients, and hopefully like at the very end of it, make life easier, and for practices themselves, and again, like the person who asked the question said, increase revenue as well, which is of course important. So
right, and I do think you're right that there's
helps.
going to be a growing expectation from patients/consumers that this sort of technology be available. I mean, especially as these youngsters out there, I'm mostly just joking, but people are using online technology more and more, and so apart from the revenue question, it's just going to be something that people demand, I think, going forward.
Sure, and and there are parts of healthcare that I think that some patients feel, whether or not if you kind of go in and have to set up an appointment online or something like that. I mean, everybody, people get, say, frustrated standing in line for whatever 10 minutes. I mean, but to say, hey, you can do this online, is people, that small thing means a lot, and I think that carries a lot of weight, and they'll see, as people are becoming more engaged in different areas, different industries, I think that, to have healthcare follow suit and to be maybe known as the practice that can do this, that, and whatever, in patient engagement, that carries a lot of weight, and that will in turn make patients more engaged in their own healthcare because it's easier. It's easier. It's more interesting. They have this, they have this information at their fingertips. I mean, I don't have the statistics, but I mean, information like the amount of people who access WebMD on a iPhone or on a smartphone is just incredible. So people are definitely getting interested in it, and it's something that will really, I think, benefit practices as they move forward.
Well, I want to thank our audience for their questions and remind them that we will post written answers to those questions with links delivered via email later in the week. Thank you, Matt, for joining us. It was a very informative session.
Absolutely, and thank you very much for having me. And again, if anybody would like to contact us, my email is mhager@nationalehealth.org. So I'd be happy to answer any questions anyone might have. But thank you very much for inviting me.
Thank you. And to learn more about NEHC and its patient engagement tools, again, you can visit www.nationalehealth.org. Remember that all registered attendees of this event will receive an email with links to both the recorded and PDF versions of the session. So watch your email boxes for those follow-up links. Format Approved is pleased to announce that the latest addition to our training program provides comprehensive training in meaningful use. The course covers the requirements for both Stage 1 and Stage 2 of meaningful use for eligible professionals and eligible hospitals, whether they're on the Medicare or Medicaid incentive programs, along with clinical quality measures, HIPAA considerations, and more. Visit formatapproved.com/education/courses_CMUP.html to register for this course. If that's not the easiest thing to remember, you can see the link right there on our screen. You can also learn more about our other training offerings at formedtraining.com. Visit formatapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button at the bottom of the screen will take you to our entire slate of upcoming webinars. Our next Learning Lunch will air tomorrow, June 26th, and will cover the subject of reporting on clinical quality measures. Keep an eye on your email box on our homepage for other upcoming topics, and thank you again for joining us today.